Welcome back to part 13 of our 15-part explainer series. Let's just jump right in, because today we are tackling a massive area of compliance and, honestly, a lot of confusion for 2025. We're going to break down exactly what preventative care can and, more importantly, what absolutely cannot be billed via telehealth. If you code for primary care or internal medicine, you know firsthand just how critical these distinctions are for keeping your practice compliant and your claims totally clean. So, looking at 2025, there is a really strict, deliberate line drawn in the sand for telehealth billing. It's essentially a fundamental conflict between Medicare wellness rules and your standard preventative CPT codes. You literally cannot treat all preventative visits the same way anymore when it comes to telemedicine. The rules are entirely different depending on whether you're reporting a Medicare-specific service or a standard CPT preventative medicine code.
All right, let's start off with Medicare annual wellness visits and G codes.
Now, while Medicare annual wellness visits, or AWVs, officially are on the eligible telehealth list, we run into this tricky little thing called the vitals challenge. You see, to successfully bill an AWV, you are technically supposed to capture specific vitals, namely BMI and blood pressure. Keep in mind, the AWV was put on the telehealth list back when a patient had to be at a physical originating site, meaning clinical staff there would just grab those vitals for you. But today, when the patient is just sitting on their living room couch, capturing a clinically valid blood pressure or BMI becomes a pretty significant hurdle. Well, to ease that exact burden, some Medicare Advantage plans are actually stepping up and waiving the requirement for capturing vitals during a telehealth visit. My advice to you, check individual payer policies really carefully, because this waiver is a massive relief for providers, right? It lets them focus purely on the cognitive and planning aspects of the wellness visit without sweating a potential audit over a missing blood pressure reading. Now, here's the absolute crucial point you need to remember: the exact exclusions. While AWVs are allowed, the initial preventative physical exam, you probably know it as the Welcome to Medicare visit, code G0402, is strictly not on the telehealth list, so don't mix these two up. The IPPE requires a much more hands-on baseline assessment, so Medicare simply demands that it be done in person.
Moving on to CPT preventative medicine codes, 99381 to 99397.
If you crack open your 2025 codebook and look at CPT preventative codes 99381 through 99397, you are going to notice a glaring omission. They do not have the telemedicine symbol next to them. That little star indicating telehealth eligibility, it's just completely missing for this entire code range. And the reason behind this is actually really simple, but you've got to memorize it. These codes require a comprehensive physical examination. The AMA and billing guidelines basically determined that a truly comprehensive physical exam, checking reflexes, palpating the abdomen, listening to the heart and lungs in detail, is highly, highly unlikely to be performed adequately over a video call. Because of that, you simply cannot bill 99381 through 99397 for a virtual visit. Period.
Okay, time for an applied coding knowledge check.
Let's see how you do with a real-world coding scenario based on everything we've just covered. Imagine a physician conducts a subsequent annual wellness visit with a Medicare patient, but they do it via audio only. Maybe the patient just didn't have a smartphone or a webcam handy. Think carefully about the service type and that specific delivery method. How do we code this? Did you get it? The correct answer is G0439 appended with modifier 93. This perfectly illustrates how to layer these rules. G0439 is your base code for a subsequent AWV, which we know is perfectly fine via telehealth. But because it was an audio-only encounter, we've got to slap on modifier 93, which is Medicare's official designation for an audio-only telemedicine service. If it had been audio and visual, we'd have used modifier 95, for sure. But for audio-only, 93 is your golden ticket to compliance. All right, let's head into our summary and next episode teaser. Let's do a rapid-fire recap of the core preventive medicine rules you need for 2025. It really all boils down to knowing your exact code set. Medicare AWVs, yes, they're in, but you got to watch out for that vitals challenge unless your specific MA plan waives it. The IPPE or Welcome to Medicare visit, absolutely not, it's strictly excluded. And those standard CPT preventive codes 99381 through 99397, also a hard no, because they require a comprehensive physical exam that you just can't pull off over a screen. Next time, in part 14 of our explainer, we're going to unpack the specific originating site exceptions for mental and behavioral health under the Consolidated Appropriations Act. Behavioral health actually has some of the most unique and flexible telehealth rules for 2025, and you really won't want to miss how those exceptions work.
As telehealth just continues to evolve at lightning speed, it really makes you wonder, will CPT rules eventually adapt to allow for remote physical exams? Or is a computer screen always going to be a permanent barrier for standard preventative care? It's definitely something to chew on as you code your next chart. Thanks so much for joining this explainer. Stay compliant out there, and as always, decode healthcare with Harshal.